Okay. Hi, my name is Logan Wahl. I am from Middlebury College, and this summer I had the opportunity to work at the Hunter College SPUR program. And this summer I researched the impact of childhood socioeconomic status on sexual identity development and substance use debut milestones in gay and bisexual men at the Center for HIV Educational Studies and Training. So to address the question of why this research is important, socioeconomic disparity comprehensively causes a huge proportion of the problems that exist in the United States today. And gay and bisexual men are a marginalized group. It is important to understand the differing experiences of this community in order to assess health-related needs. And so putting those two together, it begs the question, if a gay or bisexual man is also from a lower class background, how do we appropriately deliver him health-related interventions? So a bit of background. Sexual identity development is often referred to as coming out. Coming out is an intricate process, and so there's huge variability in the environment in which an individual comes out, and this variability can provide a safe or dangerous environment, and there's often potential for social, psychological, and physical dangers. So a bit more background. Sexual identity development research is often measured by milestones, and research typically look at the mean ages at which people first acknowledge that they have had same-sex attraction, a same-sex sexual experience, self-identification as gay or bisexual, and disclosure of a same-sex sexual attraction identity. And so the age at which these milestones occur can vary. There's a demonstrated cohort effect, which means that later generations came out later than younger generations do now. There are small indications that race and ethnicity may impact the milestones, but that's largely unclear. And the effect of socioeconomic status on these milestones has largely never been researched. As far as substance use, alcohol and drug use are more prevalent in gay and bisexual men than general populations, and there's little research on the initiation of drug use, especially as it relates to sexual identity development. And so I wanted to look at how these milestones were related and how they were impacted by socioeconomic status. My research questions were, what is the association between sexual identity development milestones and substance use milestones? And how is childhood socioeconomic status associated with sexual identity development and substance use milestones? So method, the data that I used was from Pillow Talk, which was a study conducted at the Center for HIV Educational Studies and Training. The PI was Dr. Jeff Parsons, and this was funded by the National Institute of Mental Health. These are all the people that made this project possible. Participants and procedures. The study consisted of 376 gay and bisexual men in New York City. These men were highly sexually active, which means they had 9+ male partners in the prior 90 days, and their HIV status was verified. It was a very complex study, and there were a lot of different measures used. The ones that I looked at mostly were the visit, the in-person visit at a baseline appointment, and then the online survey from home. So here are the demographics of the participants. Race, in terms of race, there were about half men of color, and employment, income, and education were fairly distributed, pretty equally distributed. In terms of HIV status, it was nearly split, but I do want to note that that is not representative of the gay and bisexual population at large. The majority of gay and bisexual men are not HIV positive. This just happens to be that it's a very highly sexually active sample, which leads to higher HIV positive rates. The age range was 18 to 73 years, mean 37 years. So with the measures, parents' class background, we asked participants if their parents' class background was middle class or higher, or poorer working class. They were split into those two groups. Sexual identity development milestones, how old were you when you first felt sexually attracted to people of the same sex, admitted to yourself that you were gay or bisexual, had sex with another man, told someone else that you were gay or bisexual. Substance use milestones, how old were you the first time you got drunk? That is, your speech was slurred or you were unsteady on your feet. How old were you when you first used any marijuana? How old were you when you first used any of these drugs? And then overall, just like the other illicit drug. So results, This is a correlation matrix that shows the association between sexual identity development and substance use milestones. And what we see here is that these two developmental processes are very related, highly related. To make sense of this graph, if you look at the intersection between two of the milestones, for example, same-sex attraction and self-identification, that's a correlation of 0.43, which means they're moderately associated. And the higher the number, the closer the number is to 1, the more closely related they are. Significant levels at 0.01 are indicated with 2 asterisks, and significant levels at 0.05 are indicated with 1 asterisk. Men from lower class backgrounds reached milestones earlier. And so what we see with this data here is that men from poor or working class backgrounds had sex earlier, came out earlier, and used marijuana earlier and used another illicit substance earlier. So, summary of the findings. All sexual identity development milestones, except first attraction to the same sex, were associated with substance use debuts. Men from lower class backgrounds came out earlier, had sex earlier, used marijuana earlier, and used other illicit substances earlier. There was no difference in awareness of same-sex attraction, self-identification as gay or bisexual, and using alcohol. Limitations of this study, recall of milestones and class background, but more milestones can cause retrospective recall bias. So the men who were 70 years old were recalling these milestones that happened when they were like 20 years old, and men who are 25 years old are remembering things from a much less, a period that was much less in the past. And this was a selective sample of highly sexually active gay and bisexual men in New York City, so they aren't completely representative of the overall gay and bisexual population. Also, using only class to compare these milestones disregards other aspects of one's background that could contribute to development. So, implications and conclusions. Gay and bisexual men from lower socioeconomic backgrounds are reaching these milestones earlier, which means they're engaging in potentially risky behaviors earlier. They're engaging in sex, and they're using substances earlier. Early initiation of sexual behavior and substance use has been shown to increase risk of HIV, STIs, substance use disorders, psychiatric disorders, poor school performance, and physical violence. These men are reaching these milestones earlier, and these milestones, reaching the milestones earlier causes a lot of issues, which means we need to intervene earlier. These populations are extremely disadvantaged, and especially having two of those identities is leading to a lot of problems. And so the goal is to develop interventions that tailor to these individuals who are a very specific group, but a large group. And so, for example, sex and substance use education should be tailored to gay and bisexual students, and especially poor gay and bisexual students. Gay and bisexual men had sex nearly a year, or poor gay and bisexual men had sex nearly a year earlier than wealthy gay and bisexual men. And so if you're intervening when they're 16, it's not going to work if they're having sex at 15. That's just not going to do. Future directions. So further research should address why these disparities exist, what exactly is contributing to these differences, what can we do to ameliorate these issues, what sorts of interventions can we develop, and are the effects of economic disparity more severe in gay and bisexual men than other populations? Thank you to the CHEST team, the National Institute of Mental Health, participants, and the Hunter College SPUR program. If you have any questions, please ask them now or email me. You can also visit chestnyc.org. Thank you.